Hi, my name is Malin Wijeratna and I am a consultant shoulder surgeon at the Three Shires Hospital here in Northampton. My special interest is shoulder replacement surgery. The shoulder is a ball and socket joint. Shoulder replacements are performed for painful arthritic shoulders. There are two main types of shoulder replacement, a total shoulder replacement and a reverse shoulder replacement. A total shoulder replacement replaces the socket with plastic and the ball with metal. In a reverse shoulder replacement, this is switched around so that the socket is replaced with a metal ball instead. The type of replacement that a patient needs depends on the pattern of their arthritis and whether the tendons controlling shoulder movement are intact and of good quality. The majority of my patients who have their shoulder replaced are only in hospital for 1 day and in a sling after surgery for 4 to 6 weeks. They feel significant improvements in their pain within 1 month and can return to driving and other activities. With physiotherapy, shoulder movements continue to improve for 12 months. If you would like to come and see me for a consultation, you can book in online or contact Three Shires Hospital directly.